Welcome to the deep dive. Today, we're going to be taking a deep dive into feline brain tumors.
Specifically, meningiomas.
Yeah, and we've got this case that's really interesting. It kind of throws a wrench in things.
Yeah, this one's pretty
It
fascinating.
really does.
Yeah.
So, where did this come from? What are we looking at?
It's a case report that was published in the Journal of Feline Medicine and Surgery Open Reports.
Okay.
And it follows this 13-year-old American short-hair cat.
Okay.
And they thought they were dealing with just like a normal run-of-the-mill meningioma.
Right.
But it turned out to have some unique features.
Okay, cool.
Yeah.
So let's jump in. What were the initial signs that something was wrong with this cat?
So the cat started showing signs of ataxia.
Ataxia. So like
Having some trouble with balance and coordination,
Oh, okay.
bumping into things.
Gotcha.
And along with this, the cat was less active and wasn't eating as much.
Oh, so like classic sick cat signs.
Yeah, pretty general,
Yeah.
but concerning nonetheless.
Yeah, for sure. So what did they do? What did the vets do?
They did an MRI and a CT scan.
Oh, well, they did both.
Yeah, to get a good look.
Yeah.
And they saw a mass in the left caudal cerebellum. It was about 1.2 centimeters in diameter.
Okay.
And the mass had a lot of the typical characteristics of a meningioma.
Okay.
It even had what's called the dural tail sign,
Okay.
which is this thickening of the duramater where the tumor attaches.
Oh, interesting.
Yeah, it's kind of a classic sign.
Gotcha.
And initially, the imaging didn't show any signs of the tumor invading the brain.
Okay.
And meningiomas in cats, they're usually considered benign.
Right.
So at this point, everything seemed pretty straightforward. But given how severe the cat's symptoms were, they
Really?
recommended surgery.
Okay. So how do you even, what does brain surgery look like in a cat?
Well, they performed a suboccipital craniotomy.
Okay.
So they basically made an opening in the back of the skull
Oh, wow.
to access the tumor. But when they got in there, they found that the tumor was really stuck to the cerebellum, and they couldn't remove all of it.
Oh, that's not good.
Yeah, that was the first sign that maybe this wasn't a typical meningioma, so they
No.
took out as much as they could safely and sent it off for a biopsy.
Okay. So were they right? Was it a benign meningioma?
So the initial results seemed like, yeah, totally a typical fibrous meningioma, known for being benign.
Okay.
But then the pathologists looked closer
Oh, no.
at the edges of the tumor under a microscope,
Oh.
and they found these finger-like protrusions of tumor cells
Why?
invading the cerebellum.
So it was invading the brain.
Yeah, they call it the parenchyma.
Okay. Okay.
So yeah, there was invasion there.
Huh. So this is not a typical meningioma then?
Well, the bulk of it seemed to be.
Right.
But those little invasions, that's not usual.
Okay.
That definitely complicates things.
Right, because I thought those were supposed to be benign in cats.
They usually are.
Okay.
And that's why this is such an interesting case. Yeah.
Because it was kind of behaving in a way that we don't usually see.
Right.
And that raised some concerns about how to treat it and what it meant for the cat long term.
So we left off with this cat with these like microscopic signs of brain invasion.
Yeah, kind of a surprise.
Yeah, really unexpected. So what did the vets do? Like, did they change how they were treating the cat after they found that?
Well, the good news was the cat recovered really well from the surgery.
Okay.
And its ataxia got a lot better.
Okay.
But, they still had to figure out what to do about that tumor.
Right, because they couldn't get it all out.
Yeah, and now they knew it was invading the brain.
Yeah.
So they talked about chemotherapy.
Oh, okay.
But they had to consider, the cat's age and its overall health.
Right, and like how hard chemo would be.
Exactly. Chemo can be tough.
Yeah.
So they had to weigh, is it worth it?
Right.
What are the risks versus the benefits?
So what did they decide?
They decided to go with a more conservative approach.
Okay.
So no chemo right away.
Oh, they focused on supportive care.
So like meds and stuff.
Yeah, things to manage inflammation and pressure in the brain.
Okay, so kind of just keep things under control and see what happens.
Yeah, basically wait and see if the tumor came back.
And did it?
Well, the crazy thing is,
Yeah.
the cat did amazing for 2 years.
2 years?
25 months, to be exact.
Wow.
No symptoms at all.
So the brain invasion, it didn't seem to matter.
Yeah, it's wild, right? It kind of makes you question what we think we know.
Yeah, because I thought brain invasion, that's bad news, usually.
Yeah, usually it is.
Okay.
But this cat just, shrugged it off.
Yeah.
So it really makes you wonder
Yeah.
if brain invasion is always as dire as we think it is.
Right. Maybe there's more to this story.
Exactly.
But 25 months, that's not the end of the story, is it?
Sadly, no.
Okay, what happened?
After all that time, the ataxia came back.
Oh, no.
Yeah. And they did another MRI,
Okay.
And it showed the tumor had grown back in the same spot.
So the meningioma was back.
Yeah.
Oh, man. So what did they do?
Well, they knew it would be a lot harder this time.
How come?
It was really close to the brainstem now.
Oh, so like a really delicate area?
Yeah, super risky.
Okay.
And they knew from the first surgery that it was going to be stuck.
Right.
So they went in for a second surgery.
Okay.
But they couldn't get all of it again.
Okay.
They got about 30% of it.
Okay.
But because they couldn't remove much,
Yeah.
they couldn't see how bad the invasion was this time.
Oh.
So the cat's appetite and activity came back okay.
Okay.
But the ataxia stayed.
Oh.
Yeah, the neurological problems didn't go away.
So even with the second surgery, they couldn't really fix it.
Yeah, it was a really tough situation.
Yeah.
And the owner, they decided to focus on quality of life.
That makes sense.
You know, just keep the cat comfortable.
Right.
Let it live out its days at home.
Oh. So how long did the cat live after that?
About 3 months.
Okay. And did they learn anything after the cat passed away?
They did a post-mortem exam, and it confirmed the fibrous meningioma diagnosis,
Okay.
but it also showed something they didn't see before.
What's that?
The tumor had invaded the occipital bone.
Oh, wow.
Yeah, bone invasion.
So not just the brain.
Nope, the bone too.
So this tumor was just like out of control.
It really was.
Huh. Is bone invasion common with these tumors?
It's not as concerning as brain invasion,
Okay.
but it's still pretty unusual.
Right.
Especially on top of everything else with this case.
Yeah, this case has been full of surprises.
It really has. Shows you that you got to expect the unexpected in vet med.
Yeah.
Even when you think you know what you're dealing with.
Right.
There can always be a twist.
So we've seen how this case went from like a typical meningioma to this whole like crazy situation.
Yeah.
What do we even what can we learn from this? How does this change how we think about meningiomas in cats?
Well, it definitely challenges the way we traditionally think about these tumors.
Yeah.
We tend to think, okay, meningioma, benign, not a big deal. But this case shows that there's a lot more to it.
Right. Like even if it's benign, it can still act weird.
Exactly.
And that brain invasion, maybe it's not always a death sentence.
Yeah, that's the crux of it.
Right.
This cat lived for 2 years with brain invasion.
Right.
So clearly there are other factors at play.
Yeah, like maybe how much invasion, where the tumor is, how healthy the cat is overall.
Exactly.
So it's not just about whether it's benign or malignant.
Nope.
There's more nuance to it.
Way more.
We got to dig deeper into how these tumors actually behave.
Yeah, we need more research, especially on cases with brain invasion.
So this case, it raises a lot of questions,
It does.
but it also opens up a whole new area of research.
Exactly.
We'll be right back with the final part of our deep dive into brain-invasive meningiomas. Okay, so we've talked about this crazy case and all the questions it raises.
Yeah, definitely turned things upside down a bit.
It did. So, practically speaking, what does all this mean? Like, if you're a vet and you see a cat with a meningioma, what changes?
It really highlights how important it is to not rely only on imaging.
Like the MRI and CT scan?
Yeah, those are important, of course.
Yeah.
They give you a lot of information.
But they might miss something like this?
Exactly. They might not show the invasion.
So you got to really look at those samples under the microscope.
Absolutely. That's where you see those tiny tumor cells sneaking into the brain.
So even if the scan looks okay, if the tumor's stuck to the brain, that's a warning sign.
Big time. You got to be suspicious.
Gotcha.
And sometimes you might even need a specialist to look at the samples.
Like a pathologist.
Right. Just to be sure.
So basically, vets got to be extra careful.
Yeah, pay attention to every detail.
And not just during the surgery,
Right.
but also when they're looking at the slides.
Yeah, got to be thorough.
Okay. And what about talking to the owner? How do you explain this stuff?
That's a good point. Vets need to be ready to have some tough conversations.
Yeah, because it's not simple.
No, it's not. You got to explain that even a benign tumor can have these tricky aspects.
Right. And brain invasion can change the outlook.
Exactly. And how you treat it.
So owners really need to understand all this.
They do. It's their cat. They need to be informed.
Yeah.
So you got to be clear and honest, explain all the possibilities.
Okay. So then what about treatment? If you find brain invasion, what do you do?
That's where it gets even more complicated.
Yeah.
In humans, brain invasion usually means more aggressive treatment.
Okay.
But in cats, we don't have those clear-cut rules.
So it's not like invasion equals chemo or something.
No, it's a lot more case by case. You
Okay.
have to look at everything.
Yeah.
The cat's age, how healthy they are,
Okay.
how much invasion there is, where the tumor is,
Right.
and what the owner wants, what they're comfortable with.
So it's a lot of discussion
It is. It's a team effort, the vet and the owner working together.
to figure out the best plan for that specific cat.
Exactly. There's no one right answer.
Okay. So what's the takeaway for cat owners? What should they keep in mind?
I think the main thing is every cat is different. Like, just because this one cat lived for 2 years with invasion.
Doesn't mean every cat will.
Right.
So don't get too hung up on one story.
Right. You got to focus on your own cat.
Exactly.
Yeah.
Talk to your vet, ask questions, get a second opinion if you need it.
Be an advocate for your cat.
Exactly. And remember, things are always advancing in vet med.
So there's hope, even with a tough diagnosis.
There is. We're learning more all the time.
Well, this has been quite the deep dive.
It has.
Brain invasive meningiomas, huh? Who knew they were so complicated?
Yeah, they really threw us a curveball.
But it's fascinating stuff.
It is. And hopefully this helps people understand these tumors a little better.
That's what we're here for. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.